This is Wellspring, presented by Spectrum Health-Zeeland Community Hospital on 99.7 and 1450 WHTC.
And on this Thursday, December the 17th, we go to a Zoom conversation. And we are joined at Spectrum Health-Zeeland Community Hospital by Sara Donkersloot. Sara, good morning and welcome back to WHTC.
And good morning and welcome to Wellspring, a live broadcast sponsored by Spectrum Health-Zeeland Community Hospital. Monday's vaccine distribution marked a significant milestone in the battle against COVID-19. And to share about the vaccine are two Spectrum Health Medical Group physicians. Dr. Phil Waalkes is a family medicine physician, and Dr. Annica Waalkes works as a hospitalist. They both love serving people. They served our nation as doctors in the military, are strong supporters of our community in schools, that they have served as team physicians, and they are committed to excellence in caring for people. And you know what? They're just really nice people. And I know this firsthand because they were my neighbors for many years. And Phil and Annica, I just want to say thanks for switching up your schedules to be on the radio with us today to talk about a really important subject, the vaccine. So good morning.
Good morning, Sara.
So I guess I really should call you Dr. Annica and Dr. Phil, because that's what most people know you as, but I know you as Annica and Phil. So I hope you're going to allow me to call you that. So Annica, this past Monday, Spectrum Health became one of 5 healthcare systems in Michigan to receive the Pfizer Covid19 vaccines. And that's an exciting historic moment for Spectrum Health, isn't it?
It absolutely is, Sara. We're very excited as well.
So, Phil, why is this vaccine so exciting and important?
Well, Sara, the vaccine will give us the opportunity to provide a safe and effective way to prevent people from getting COVID vaccine. It's been tested extensively and deemed to be safe in most populations. There are a few people that they're recommending not get it yet, particularly those under 16 and those who are pregnant haven't been deemed or labeled able to get the vaccine yet. But the rest of the adult population should strongly consider it because it will be what helps us shorten this pandemic.
Annica, tell us about how the vaccine works.
Sure. So to try and make this less scientific, because there's been a lot of lingo and kind of some mistruths out there. So I'm going to try and make this a little more simplified. And if we think of the 3 little pigs, I think just about everybody is aware of the 3 little pigs and the straw house and the twig house and then the brick house. So everybody can do their part to build a strong immune system by getting enough sleep and eating well and exercising and stress reduction and wearing their masks and hand sanitizing, and then avoiding groups. And if we think of an extra security layer that can be put on your house, that's a vaccine. So it's the way these work is they give us a signal in our body such that when this virus is presented to our front door, our alarm system goes off and we can be aware of it and make sure that all of our infection fighting cells and proteins in our body are ready to defend our front door.
You know, Phil, I think a lot of people are saying, I don't want to get this vaccine because I could get COVID because of it. And just talk a little bit about that.
Sure. That would fall under some of the mistruths that are being propagated. The COVID vaccine is not a live virus vaccine. The COVID vaccine is a piece of messenger RNA which helps our body produce a protein that looks like the spike protein on the virus, which is what triggers the response so that we don't get infected. So you're not actually putting COVID into anybody, and therefore you won't be able to reproduce COVID in your body. So you're not going to get the COVID virus infection from this.
Thanks for just, sharing that, because I think that's so important for our listeners to know. So, Annica, it's a multi-dose vaccine. That's different because, right now we get the flu vaccine and, we get it. So what does it mean? And talk about how the vaccine is going to be administered.
Yeah, so depending on which company has produced the vaccine, because there are two companies currently, one has a 21-day booster, the other one has a booster at 28 days. So think about your kids when you're bringing them in for their childhood immunizations. Many of our vaccines have either 2 doses or a 3-dose series. That first dose gives our body with this virus approximately 80% effectiveness, and then with that second dose 21 to 28 days later, it then boosts our effectiveness up to about 95%. And it is going to be important that you stick with the manufacturer that you had for your first vaccine.
And where are you going to get the vaccine? In your arm, I'm assuming? I mean,
Yes.
When I was a little kid, I had it in my behind.
Yeah, so because this is an adult vaccine at this point, it will be administered, in your deltoid, so the upper part of your arm.
Okay, thank you for that. So, Phil, who's being vaccinated first? And first of all, talk about that. And when can the general public get it?
Sure. Good question on the last part. In the government's sense of making plans, they've got 4 stages that they've labeled 1A, 1B, 1C, and 2. 1A phase is currently being enacted. This is going to be for those that are actively treating COVID-19 patients. So our inpatient hospital workers, from the physicians, the nurses, the housekeeping, the transport staff, as well as ER staff, will be the first in the medical community to get it. In that wave also are nursing home residents. Nursing home residents are our most vulnerable population and tend to have the worst outcome. So if we can get them protected, they will not end up needing to go to the hospital. The second phase is going to be the rest of healthcare. And then phase 1C is going to be the rest of essential workers. So that's when we're going to see grocery store attendants and people in the public eye who have to interact with people will get it. And then phase 2 will be the healthy 16 to 64-year-old. Part of phase 1B will also be the 65 and up, and those with medical conditions that will leave them at greater chance to get sick. The hope is all of this takes place in the next 3 months. So as you mentioned, Spectrum Health received their first batch yesterday or early on Monday, and we started vaccinating, and we're actively scheduling people right now. The community, probably March, for that healthy group, that 16 to 64-year-old group, I would expect we'll be able to get through phases 1A and B and C within the next month to 2. And then it's another month after that till we get through everybody. Most of those in the vaccinating world and distribution world are expecting, are hopeful that the all of America will at least have the opportunity to be vaccinated by June.
Sara, can I step in for a moment? We are talking, by the way, with Dr. Phil and Dr. Annica Waalkes from Spectrum Health, dealing with the COVID-19 vaccine. Dr. Phil or Dr. Anna, either one of you, I'm going to ask a question that my mom has asked me, but I think a lot of our listeners will feel the same way. My mom is 94. And when we were talking about the vaccine, she says, I'm afraid right now of taking it. I don't know for certain if I really should take it or not. Either Dr. Phil or Dr. Annica, how would you allay someone's fears about taking the vaccine because they don't know about it? How would you, as physicians, try to assure them this is going to be okay?
Yeah, so great question, because I take care of a lot of those 90-plus-year-olds when they make it into the hospital. So for one, talking with their doctor is crucial, because not every 94-year-old has the same medical conditions or the same social environment, both of which play a role in their susceptibility to get an infection from the COVID virus. And then as well, there are information sheets available through the CDC, the FDC, Spectrum Health has their own. There is a new one that just came out, and I'm going to have Sara give that at the end of our program because it's not on my current screenshot that's up. But yeah, definitely talking with her provider. And this is, as I remind people, this is a tool. This is not a standalone cure for this virus. So just getting the vaccine alone is not going to ensure that she does not get sick because of the other measures that are equally as important.
But Phil, when we talk about, the trials, it was approved by both vaccines now by the FDA, correct?
Correct, for emergency use. So these haven't followed traditional FDA approval, but these trials are very extensive. If we stack these up against previous vaccine trials, like the most recent would be the human papillomas HPV vaccine that, we were impressed when it was going through 10 to 15,000 people, and we deemed it safe and effective at preventing HPV infections and brought it to market. Both of these enterprises, both Moderna and Pfizer, have had 30,000 plus people. So you're looking at almost 80,000 people have been in these testing processes. They've been going on for months. They've been vetted by multiple non-governmental entities as well. So I was listening to a physician from Brown who's in pediatric infectious disease, who, his biggest concern was the vaccine trials have been going on for a few months, but what do we expect at 6 months, 9 months, a year? Will it last? Because we know that, or we're seeing that people who get the novel virus infection, their immunity wanes by about 3 or 4 months, and then the antibodies are gone. From his experience and what they've produced with these studies, these antibody responses are still at 95% strength at that 3-month point. And he says from previous experience with vaccine trials, he expects this to last well past that 9 to 12 months in our body, still allowing us to create a reaction to fight the infection. And as Annica said, it's not a cure, it's a preventative measure. So we still need to get enough people vaccinated such that the virus doesn't have anywhere to go. Go ahead.
So Phil and Annica, we have about 2 minutes left, and I'm going to ask you a question for both of you. As physicians, why are you excited about this vaccine? What does it mean for you personally? And what would you say to people who are listening, who are on the fence out there that are saying, I don't know if I should get this vaccine? So you each get a chance.
Yeah, I'll jump in. I get to do this daily. I try to allay their fears. There is no evidence that anybody's put a microchip in it. It will not make you infertile. There's a lot of misinformation, and I understand that. It is a novel vaccine, but it's not new technology. This technology has been in development for almost 40 years. Its safety is pretty significant. So I'm comfortable with that. I'm comfortable with the tech, and I'm becoming very comfortable with the efficacy. I want people to get this so that we can try to get back to living the way we're used to, so that we don't have to consider who we don't come into contact with. So kids can go back to school, so we can get back to visiting our loved ones in nursing homes and even at their own homes. And right now, that's just not safe. We're seeing a big spike. The numbers yesterday nationwide were the highest they've been. Hospitals are full and stretched. I get to see my wife come home and she's spent. And I think getting the vaccine and seeing this come to an end will go a long way to help, heal our community, heal the nation, and make people comfortable with just living again.
Okay, Annica, you got about few seconds. Yes.
Well, I really just reiterate what Phil said, and that we're excited that this may be the start of the control phase of this virus. I've spent far too many days taking care of patients who aren't going to see their loved ones at the end of their life, and that's not why I went into medicine. This is hard on everybody. It's emotionally hard, it's physically hard, it's hard from an economic perspective, and we just need to start that healing phase.
So thanks for being here. I know both of you are going to be the first ones to roll up your sleeve and get the vaccine. And thank you for being those ambassadors in the community. Until next week, Spectrum Health-Zeeland Community Hospital wishes you well. And Gary, I will give you that website for people to get to. Thanks again.